pick the things that you like to do. I suggested 3 a minute ago. Maybe it's adult orthodontics. Maybe it's cosmetic dentistry. Now, cosmetic dentistry could be a lot of things, but I tend to think of cosmetic dentistry as lab fabricated porcelain veneer cases. Great way, to grow that part of your practice. Perhaps it's placing and restoring dental implants. The need for dental implants is huge, Naren. I'll share a statistic with you that may surprise you. Naren, of Americans, do you know that 76% of Americans aged 35 and older are missing at least one tooth? 76%. And by the way, that doesn't include our third molars, our wisdom teeth. So 76%, more than 3 out of 4 adults, 35 and over, are missing at least one tooth. And they could be a candidate for a dental implant. Now, maybe within dental implants, you're not excited about placing them, but you'd like to restore them. And in that case, you could work with a specialist. It could be an oral surgeon. It could be a periodontist. You could work very closely with a specialist to place the implants, and then you could restore them. Maybe you're the kind of dentist that enjoys placing your implants, and you can take a massive amount of CE, become very competent at placing implants, and you can place and restore implants in your own practice. Other examples of high-value services could be treating OSA, obstructing sleep apnea. Maybe that's something you really enjoy doing. Maybe it's doing oral conscious sedation. I think of that as a high-value service, oral conscious sedation. Maybe we can get very narrow in scope. Maybe you're that dentist that loves to do the ankyloglossia procedure. That's the lip and tongue tie release that you do with a laser, and you do that on infants that have been unable to nurse. And maybe that's a service that you'd like to offer in your practice. Maybe you enjoy treating TMD, TMJ. And maybe that's something that you really find exciting. Maybe you're that dentist that enjoys a more expanded scope perio practice. Maybe you enjoy doing certain types of periodontal surgery. And that could be something that could be with the right amount of CE. That's something that you could incorporate into your practice. And there's just so many examples that we could go on and on about, but it's really kind of finding your passion. What is it that you're passionate about? That would be a good question I would ask you to ask yourself. What is it clinically that you're passionate about? Maybe it's complex restorative dentistry, where you have patients that have more complex dental needs, and you can do full mouth restorative dentistry. And maybe that's something that, kind of tickles you, and the idea of doing more of that is exciting. One of the really cool things about high value dentistry is I've always said that dentistry rocks, because we have the ability to change people's lives every day. And I believe that with every ounce of my DNA. And it could be, something in the general dentistry realm. It could be getting a patient out of pain. Could be something that really, the patient has a tremendous, it's changing for them. To go from pain to not having pain, is life-changing. But I tend to think more of the high-value services as life-changing dentistry. When you provide a beautiful smile, when you replace a floppy lower denture, with dental implants, when we take a smile that has spaces or crowding, and through adult orthodontics, we give the patient a beautiful smile. When we take a patient that has a lot of patchwork dentistry done over years and years, and now we do full mouth restorative dentistry, that can truly be life-changing. The ankyloglossia procedure could be life-changing, especially for the mom, who genuinely wants to nurse, but isn't able to because their infant can't latch. That can be life-changing dentistry. TMD, TMJ, life-changing, because patient living with pain is no fun. And through your care, skill, and judgment, you get them to a point where they're not experiencing pain. And that can certainly be considered life-changing. But I think the high-value services are more often associated with life-changing dentistry, than everyday general dentistry.